With my long-term interest in the treatment of headaches, I was very excited a couple of years ago when I was first approached with a very simple but very sophisticated device for the treatment of headache, which was the sort of endpoint of the development of transcutaneous electrical nerve stimulation. This device was the Cefaly, which is a simple headband device with one button that provides 3 different programs and allows us to treat, possibly for the first time, many patients who are resistant to the treatment of their headaches by medication, or where medication has actually caused an increase in their headaches, the so-called chronic daily headache, which is often related to an overusage of analgesics, and particularly paracetamol and aspirin. The Cefaly allows us to provide the patient with a simple device that they can use by themselves, which has only one functional button, which fits on the forehead like a pair of spectacles, and provides treatment which has been shown in a number of studies now to be far more effective than placebo in particular, but also far more effective in some cases than the anti-epileptic medications, which are also available for the treatment of headache, and with far less side effects. Like all transcutaneous electrical nerve stimulators and related devices, the Cefaly produces an electric current which is transmitted through the skin by self-adhesive electrodes, a single electrode in this case, which stimulates 2 of the major branches of the 5th cranial nerve, the trigeminal nerve. So it stimulates the supratrochlear and the supraorbital branches of the trigeminal nerve, which of course is a major nerve coming directly from the brain. And the impulses from the Cefaly electrode are then transmitted through the branches of the trigeminal nerve and produce an area of numbness, change sensation, all the way up to the crown of the head. So that this sensation is associated also with depletion of the various neurotransmitters that are said to be associated with the production of migraine, muscle contraction headache, and in some cases cluster headaches as well. And what we've found is that in some of these patients with very resistant headaches or problems with major side effects associated with medication, that within 5 to 10 minutes in many cases, the patient will experience a decrease in the severity of their migraine. In some cases, that be associated with a feeling of marked relaxation and sometimes drowsiness, so that the patient can get that rest that they require while they're having their treatment. And in other cases, what we can do is interrupt the cycle of the headaches by reducing the frequency, duration, and severity of those particular headaches, all in a very, very simple device that can be worn like a pair of spectacles.